Kawonga from the Wits School of Public Health joins us to unpack these latest trends. Mary, very good evening to you. We learned quite a little bit more today about COVID, the dramatic increase in infections and deaths. What are we preparing ourselves for as the third wave looms?
Good evening, Jane, and thank you very much for having me on your show. I think, we've sort of been through two waves already, so we sort of already have some sense of what we expect to see in this third wave. I think the initial predictions that have been done in Gauteng province indicate that the third wave might be less, the force of infection might be less. However, it's still a large wave, because if you remember, our second wave was quite big it was almost similar in size to the first wave. So we've been seeing an increase, correctly, as you said, in the number of cases and number of deaths. And so we've already started seeing increases in hospitalizations. And so we expect to see, as we expect to see in a wave like this one, is that there'll be more hospitalizations and unfortunately more deaths. And we've started seeing that already. However, it's not doom and gloom. I think there is opportunity to try and stem the tide of the pandemic, flatten the wave as much as possible, and even slow down transmission by implementing the protocols that we know work. Wearing masks in public.
Excuse me, Mary. I mean, what about the vaccine? We are hearing that South Africa could have its own vaccine within the next 5 years. But do we have enough to do the right thing with what we have to play with at the moment?
Well, the thing with the vaccination program is it's very, very early. It's in its infancy, really. If we haven't vaccinated enough people to even have an impact. That's why I'm really emphasizing the tools that we have used in the past two waves, which is wearing masks, sanitizing, avoiding crowded places, the non-pharmaceutical interventions. And those are the ones that we have at our disposal currently, because we're nowhere near the numbers that we require for vaccination to have an impact on reducing the overall infections in the province, in the population. I think the authorities are ramping up. They're giving vaccination as quickly as they can based on the supplies that they're receiving from the National Department of Health. That's the rate-limiting step, the fact that vaccines are not necessarily arriving in large enough numbers. So actually a number of vaccination sites are actually waiting to open because they're waiting for vaccines to arrive. And so until we get to a point where we've vaccinated enough people to have an impact, that's the level people refer to as herd immunity, which is unlikely to happen in 2021 for us if we want to be realistic. We do have to rely on the tools that we have been using before. Non-pharmaceutical interventions, isolation when people have been diagnosed to have COVID-19, to isolate at home or in a facility where it's possible, quarantine if you've been in contact with somebody who's got COVID-19 for 10 days before you can go out. And so that's what we really have to do.
It's good to remember the basics, isn't it? Because I think we forget as we plunge into the third wave. I'm just wondering what your thoughts are regarding what the WHO said. They said that we are not ready, this is South Africa, for the third wave, and that we are doing worse than any other country in Africa. How is that possible?
I think one has to look carefully at what they said, and I really want to look at the basis upon which they made those assertions, which I haven't yet looked at. The comparisons are the countries in Africa are at very different phases of the trajectory, and they're South Africa has had the highest case count, as you can imagine, as we all know. And I think what we have observed from some studies that have come out is that in Africa in general, for example, there was a paper that came out last week. In Africa in general, patients who require critical care have pretty poor outcomes. And that includes patients in some South African hospitals that were included in that study. But that's something that is not entirely surprising. We know when people do require critical care, they're very sick. But I think what they were showing was that the outcomes for patients once they do require critical care might be actually worse than patients in the West. But for the WHO to make the assertion about South Africa being worse is something that, like I said, I'll have to look at the data upon which they made those assertions.
Well, Mary, it was very good to talk to you. Mary Kawonga, thanks a lot for your time.